The week before healthcare exchanges will be open for Americans, the battle over the Affordable Care Act raged on in Washington. Here in Michigan, we're learning more about how much the plans may cost. So before we start to look at the specifics about Michigan right now, is a very interesting week in Washington. I'm sure you can both agree on that.
Oh, yeah. I mean,
that's the one thing that you can both agree on when we're coming to healthcare.
It's going to continue to be interesting, and it was particularly, again, citing personal experience. Both Steve and I got letters last week from our employer that said, because of the Affordable Care Act, we are drastically changing your insurance, limiting your options. And
you're not alone. There are a lot of people that are now.
And it's going to affect everybody. But remember, the words kept running through my head. If you like your insurance policy now, you can keep it. If you like your doctor, you can keep your doctor. And none of that's true. You're not going to be able to keep your insurance policy necessarily, and you may not be able to keep your doctor. We don't know.
I'm sure that's none of that's true, but we're going to start to figure out now in the next week.
It depends on who your insurer is. It depends on who your employer is. There are some places where...
But he didn't say that when he made that promise.
There are some places that are going to... that healthcare plans are going to change quite a bit. There are some places, my wife's employer is not changing their healthcare at all. But, you know, it depends on where it is. The key here is that what's happening, and this is what conservatives don't like, is that those of us with insurance, with jobs, are being asked to chip in to pay for the expansion of Medicaid and the subsidies that people will use on the exchanges to get more people covered. The long game here is that you lower costs by eliminating the wild card of all these uninsured people wandering into emergency rooms.
Well, if that's true, then it will be the first federal entitlement program in history that came in under cost projections or at cost projections. And that the conservatives object to the idea that instead of lower premiums, as was promised, $2,500 per family was promised. It could go as high as $7,500 per family more per year. And remember the objective here. The objective here was to make sure everybody had insurance. We're going to go through this entire disruption. Everybody is going to pay more, have fewer options.
Not
you don't know.
Going to pay
Most
more.
of us are going to pay more.
Some people will.
Have fewer options. And at the end of the game, the Congressional Budget Office says 30 million Americans will still be uninsured. We started out with 45, now 30. All that disruption for a very small return.
Do you think that the administration has done a good enough job in terms of educating people and getting a lot of those younger people, the healthier people, the ones you need in that pool, to say, now I've got to sign up and get myself insurance?
That's the challenge, right? You've got to start, and you know, frankly, if the Republicans would sit down and stop trying to fight over the concept of the law, which is settled, and start talking about, well, now that we have it, how do you make it more effective?
I think that's what's been lost. I think that's what's been lost here.
You have got to get young people
won't hear about that. You've got businesses, labor, both complaining that this law is going to be a disaster for jobs. We're already seeing 2/3 of the jobs being created, new jobs are part-time jobs, and because of that partisan, poisonous partisan environment, nobody will stop and say, hey, we've got to fix this thing before it runs our economy off the rail. This law needs a major rewrite, a major overhaul, and the administration won't even consider it.
But you just said it.
That's absolutely untrue. The
administration will not even
absolutely
consider
untrue.
The president now ought to be saying, well, how do we fix this?
When have the Republicans suggested an actual change other than repeal?
Listen, Washington is run by the Democrats, Steve.
Well,
the president has a responsibility to lead here. He created this mess.
You have Democratic senators.
You passed this law without any Republican input, and now you want them to fix it?
Bill Casey from Pennsylvania has suggested, I don't know, 15 different changes that should be in the law. And
where's the president?
What's the Republican response? Repeal it. You can't get anywhere because Ted Cruz wants to stand up and talk for 21 hours about green eggs and ham.
I was just going to start reading that. I was going to start reading that right now.
Still committed to this law and still fostering
being committed to the law is not the same.
The myth that he started with, that it's going to save you money and that it's going to be better coverage, and it's going to be neither. It's going to put a lot of people out of work, and we need to address that part of it.
I mean, but you just said something, Nolan, I thought that was interesting. You said that poisonous partisan attitude that's in Washington right now. I'm not quite sure that you can get beyond that to even fix whatever ails this law.
But the poison is coming almost exclusively from one side.
That's not true. You listen to this president every time he opens his mouth, he divides. You listen to this president every time he talks. It's those Republicans, these people who don't want you to
hang on, let him finish, and then you get to go.
That is not going to foster any sort of cooperative environment. This has been the most divisive, ineffective president in terms of building coalitions in Washington we've ever had.
All right.
It's on him.
All right, Nolan, now Stephen, go.
You do not see the president saying, it's my way or we shut down the government. You do not see the president saying, it's my way or we don't pay the debt. Now. You don't see the president saying, it's my way or I'll sink the whole ship. That has been the Republican approach. And so how do you negotiate with it? It's like negotiating with terrorists.
So the president said over and over again, I'm not making any changes. That's off the table. This is off the table.
He hasn't said any of that.
He says it's 100% of Obamacare or nothing.
No, he has absolutely not taken that position. He has not taken that position.
Has taken that over and over.
He has said over and over, and that's not even faithful to the way that the law was crafted. They held 60 hearings during which Republicans got to.
He's ignoring the very law he passed, exempting Congress, which was counter to what the law says, exempting other people, which is counter the delay.
Okay, all right,
runs against the law, Steve.
We can go back and we can take a look at how this was all put together, and we can argue that for probably the next 3 hours or so. My thing is, you've got people sitting at home who are seeing what's happening in Washington. They're seeing, someone reading Green Eggs and Ham for 21 hours in Congress, and you say, well, wait a minute, but how is this going to affect me, and what do I need to know before this is implemented? And I think that there's a huge disconnect between what's happening in Washington, D.C. right now and what people are really existing with and what they need to know.
Well, the hasty implementation of this has really created a lot of confusion.
The implementation of it passed 5 years ago.
The law, the rules are still being written, even if it's being implemented.
There are changes that I think that, and the variation, the fact that people are like, well, we still don't know exactly how it's going to work is unnerving for people.
Well, why have we had the delay that we had? First of all, because there was a court challenge that took, 3.5 years?
That didn't delay the planning. It didn't put anything on hold.
It put a lot of things on hold because you didn't know whether you were going to be able to implement it.
It didn't put it. The planning proceeded. The funding proceeded. It
was unclear whether, first of all, whether the mandate would survive and whether if you lost the mandate, whether the rest of the law could survive intact.
The funding wasn't on hold and the implementation wasn't on hold.
Right.
I'll tell you what has been.
Okay, we're going to wrap this up in a minute.
Insurance companies are not throwing people off of coverage because of pre-existing conditions anymore. Women are able to get basic health care exams every year under their plans.
Young people are able to be on their parents' plan much longer.
Those are the things that we know are working.
That's right. We're going to get a couple of kids on your plan there, Nolan.
And what we also know
I'll put my kids on
is that this plan depends on getting young people to sign up, and yet we're doubling and tripling their premiums. I don't see how that happens.
That is going to be
the premiums on the exchange in Michigan. The silver plan, which is the middle plan, is $271 a month. So how do you call that more than
a 27-year-old getting the same coverage he's getting now will pay 200% more?
Let me ask you this: so what's the penalty? If it's $271 a month? So what's the penalty if that person does not sign up?
$400 a year.
Right. I would
We are not going to be able to pay for this unless.
I would
see that is going to be the very interesting part.
The truth is, you can't have European-style health benefits without European-style tax rates. And in Europe, the middle class pays 50% income tax.
All right. Well, we're going to be.
We got to make a decision. Are we willing to do that?
I agree with that. I agree with you.
Well, then be honest.
I do not like it.
I would have gone with single payer, as would the president.
But you can't pretend you can do that without huge tax hikes.
Fine, but I'm willing to pay taxes for things like that. That's a big difference between liberals and conservatives. We're willing to pay for things that actually make life better for people. I don't have a problem with that.
You talk to those people. We got 50% of the people not paying taxes now. You go to them and say, hey, now you got to start paying taxes again. And by the way, it's going to be 30-40% of your income.
All right. And scene.